Hi, and welcome to the Balancing Act New York edition. I'm Montel Williams. We're bringing you community stories and introducing you to businesses and people who are making a difference. So let's see who's making a difference right here in your neighborhood.
On this episode of The Balancing Act, we'll take a look inside a nationally recognized physical rehabilitation treatment center. Today on The Balancing Act.
We all know how important staying healthy is. Check out our next story.
The need for medical care and rehabilitation has been increasing in recent years as more individuals require assistance in maximizing their functional recovery and restoring their independence after a life-altering event. It is crucial to recognize that this form of physical and medical rehabilitation extends beyond seniors and could be appropriate for anyone following injury, surgery, even managing symptoms from chronic conditions. One of the nation's top-rated rehabilitation hospitals, Burke Rehabilitation offers the full spectrum of inpatient and outpatient rehabilitation services.
The primary goal of Burke Rehabilitation Hospital is to help patients achieve their medical stability and their highest functional level possible. Our goal is to help the patients become as independent as possible, work with their caregivers and their family members with the ultimate goal of returning home and into the community. Burke has a holistic approach to assessing patients' needs. And depending on the patient's unique situation, their diagnosis, and their functional recovery, their stay at Burke will vary depending on that. Some patients stay a week to 10 days. Other patients may stay as long as 2 to 3 weeks. Understanding the different options of post-acute care can oftentimes be very, very confusing. Hospital-based rehabilitation care is just that. It is care provided at a hospital environment. That means we have 24-hour physician coverage who leads an interdisciplinary team of rehab professionals that include nurses, therapists, social workers, and a whole array of clinical experts that specialize in the field of rehabilitation medicine. For patients who need an inpatient level of care, there are typically two options. There's acute rehabilitation and there's subacute. Acute rehabilitation offers a hospital-based level rehabilitation care with 3 hours of therapy, rehab nursing, and a full-time 24/7 physician and medical services. In the subacute option, that is a nursing home level of care. They have physicians, but they're oftentimes not 24/7. The rehabilitation care in a nursing home is provided based on what the patient needs, but generally speaking is limited to 1 or 1.5 hours per day. Over 50% of the patients who are cared for at Burke have some type of a neurological condition. A very common neurological condition that we care for is a patient after they've had a stroke. We also care for patients who've had a spinal injury, brain injuries, and other neurological conditions such as Guillain-Barré, multiple sclerosis, and Parkinson's disease. We also care for patients that have cardiac conditions, pulmonary conditions, and orthopedic conditions. And of course, we also care for those patients that have had amputations. The Burke difference is the recognition that we've achieved in U.S. News and World Report. We are one of the top rehab hospitals in the United States. Another important distinction that we have is that specifically in New York State, we admit the highest number of patients following stroke in the entire state. Another important achievement is that Burke has the lowest readmission rate in the entire United States. If you are a patient at Burke and are discharged home back to the community, you are likely to remain there. You have a very low likelihood of a readmission to the acute care hospital for a similar condition. Lastly, Burke offers a holistic, patient-centered, focused care. Our team includes rehab specialists, physicians who have the specialty of rehabilitation medicine. We have nurses who have dedicated their careers to the rehab goals of the patients. And we offer an array of therapy services, physical therapy, occupational therapy, and speech-language pathologists. The rehab specialists have care which is coordinated by our physicians, and they help to optimize the patient's medical stability and independence. And we strive to get the patients back to their community, back to the life that they want to live. At Burke, we have created the Marcel Caregiver Center. We recognize the important contribution of caregivers to the patient's recovery. And we dedicated a space and resources just for the patient caregivers. We include the patients and their caregivers in every step of their recovery process. We invite them to attend therapy sessions, and we invite them to participate in nursing care to ensure that the patients and their families have a successful transition to home.
Burke Rehabilitation provides every expertise for every life, from stroke, orthopedic and cardiopulmonary rehabilitation to traumatic brain injury.
Burke is a specialized hospital, and they have unique units for each of the patient populations that we serve. We have a unit devoted just to patients that have had a stroke. We have units for patients with brain injury, for spinal cord injury or spinal cord surgery. We have units for patients that have orthopedic needs and cardiac and pulmonary care needs, as well as patients with amputations. We actually have state-of-the-art equipment in each one of the therapy gyms to maximize the patient's active participation in the rehab process and help them to achieve their maximum level of independence. To determine appropriateness for a patient to come to Burke Rehab Hospital, we actually evaluate them while they're still in the acute care hospital. We have dedicated staff who review the medical records, discuss the patient's needs with the acute care team, and when possible, we actually visit the patient in the acute care hospital. Our goal is to hire experts in the field of rehabilitation medicine. We hire physicians that devote their careers to the care of the rehab patients. Our nurses are experts in rehab nursing. Our therapy staff is second to none. They have devoted their careers and their expertise in the unique specialties of physical, occupational, and speech-language pathologies. One of Burke's mission is to train the rehab specialist of the future. We offer a graduate medical education program for future physical medicine and rehab physicians. We also offer a robust nursing program and therapy program for physical, occupational, and speech therapists. To support the medical team of physicians, therapists, and nurses, we have additional services that include nutrition, dietary care. We offer social work and discharge planners to help our patients transition back to their home environment. We also have respiratory therapists and therapeutic recreation. For patients who transition home, they oftentimes need to continue their rehab journey in an outpatient setting. We offer a large number of outpatient services that have physical, occupational, and speech therapy close to your home. We are constantly looking at opportunities where we can bring innovation and expertise to the patients that we serve. We are excited to offer state-of-the-art services now, and we look to continue that journey into the future.
Burke's therapies reduce the risk of complications and help you reach your maximum recovery with focused rehabilitation centered on each patient's unique needs. Burke has the lowest rehabilitation hospital readmission rate in the country.
Burke is a leader in neurological rehabilitation due to the patients that we treat, as well as the staff that we have here that are all focused on our patient population. Burke actually treats the most number of patients who have sustained a stroke in New York State. We have been around for a very long period of time, and we have experts in our field that are here focused on the patient and only focused on their personalized outcomes. We also have rehabilitation nursing, who are nurses with specialized training in taking care of patients with neurological conditions and helping them along their way of recovery and rehab. Our interdisciplinary team is made up of experts in the fields of physical therapy, occupational therapy, speech therapy. We also have rehabilitation nursing, social work, and case management professionals, as well as neuropsychology and neuropsychiatry consultative services. Additionally, we have dietitian and nutrition services that really want to make the personalized experience for the patient. The typical duration of rehabilitation for patients who have sustained a brain injury is truly lifelong. When patients are stabilized at the acute care hospital, they will then come to Burke if they have sustained significant deficits as a result of their brain injury. Typically, patients will be at Burke for a period of 2 to 3 weeks, which is when we are working with them and keeping close eyes on their medical condition and ensuring that they are receiving as much therapy as possible. After they leave Burke, we typically are getting our patients home with either home care services or directly to our outpatient facilities where the physical therapy, occupational therapy, and speech therapy will continue. Through the generosity of several different grants, we provide very personalized education for our patients as well as their caregivers that not only occurs in the inpatient setting, but also transitions us to the outpatient setting where these educational models and programs are provided based upon where the patient is in their journey of recovery. Our goal at Burke is always to get our patients home. However, there are sometimes reasons why that cannot occur. And our team at Burke really works with patients and their caregivers in order to help them transition to other facilities as smoothly as possible. Our team works closely with patients and their caregivers to make sure that we are all working toward a common goal. From there, our social work and case management team works very, very closely with the patient and the caregivers to identify where the next institution or facility will be and make sure that that transition occurs as smoothly as possible. So one success story that really stands out is when a younger woman came to Burke after having had brain surgery that left her with a lot of deficits, including inability to toilet herself. She had really a lot of difficulty getting in and out of the bed, and she really couldn't walk independently. So she was with us at Burke for several weeks, and she continued to progress really, really well, had transitioned home with family members, and then over the years, as I've received Christmas cards every single year, I've seen that she has continued to progress, and she just welcomed her second child and has reintegrated back into the community working part-time. This really stood out as it was a young patient who continues to attain her goals that she had set forth when she had first come into the hospital. Success stories like this is exactly why I came into brain injury medicine and why I've dedicated my life to helping people who have sustained these types of injuries. No one ever signs up to have an injury to their brain, and this is one of the most vulnerable times in their lives. And I want to be here to help the patient and the caregivers as they progress and find their new way of life.
Burke's intensive neurological rehabilitation programs focus on maximum recovery from traumatic brain injury, spinal cord injury, and stroke.
Burke has worked on many complex brain injury cases. We are able to treat patients who have sustained a traumatic brain injury as a result of a fall or having been in a motor vehicle accident. We also treat patients who have sustained a stroke, whether it was due to a bleed or due to a blockage. We are also prepared to treat patients who have had tumors that have been removed, if it's been a patient who has become recently confused due to an infection. Also, patients who have had a brain injury as a result of loss of oxygen to their brain, perhaps during a heart attack. In short, Burke is prepared to take care of patients who have had any complex brain injury. Burke customizes our treatment plan based upon the patient's presentation and where they are having difficulties and where their strengths are. We want to be sure that we're able to treat the person as a whole. It's a holistic approach, and this is where the vast number of disciplines of professionals that interact with a patient on a daily basis really is able to work together towards a common goal with the patient in the center of our care. Burke utilizes several forms of advanced technology for patients who have sustained a brain injury. These technologies include computer stimulation, electrical stimulation for the nerves and for the muscles, as well as gait assistive technology. Burke's specialized staff and qualifications are truly remarkable and speak to our dedication to rehabilitation. Our interdisciplinary approach is based upon the interaction and communication that occurs between our physicians, our nurses, our therapy staff, as well as everyone in our neuropsychology, dietary, and case management teams. Technology is integrated into the rehabilitation process at all different aspects of their rehabilitation course. This will include appropriate technologies in structured therapy sessions, but also we want to try to translate that to when patients are in their rooms or interacting with their caregivers so that they're getting more out of their rehabilitation course. The goal at Burke is for all of our patients to return to their life and have a quality of life for which they are proud of. We want to help them along this rehabilitation journey every single step of the way.
Burke Rehabilitation has been pioneering innovation in rehabilitation for over 100 years.
At Burke, I'm an occupational therapist, and I'm also the clinical team leader of the spinal cord injury program. As an occupational therapist, I work to rehabilitate patients after injury or illness, focusing mostly on the things that matter most to them, such as bathing, dressing, toileting, potentially cooking, whatever they need to do to be independent at home. As a clinical team leader, I supervise occupational therapy, physical therapy, and speech pathology for specifically the spinal cord injury population, where we all are working together to get those individuals home as safely and as independent as possible. Burke is a leader in rehabilitation because it is committed to innovation and progress. Some of the ways we do that are through different programs as well as different technologies. So in the spinal cord injury program, we have many technologies that help a person walk again, help a person be able to use their environment when they don't necessarily have the motor function to do so. They're also dedicated to new ideas and new programs. Neuromusic therapy began at Burke in 2021 due to a partnership with MedRhythms, a company based in Portland, Maine, which focuses on neuromusic therapy services as well as digital therapeutics. Through this partnership, we were able to bring on our first part-time neuromusic therapist, thanks to philanthropic dollars brought in by various donors. We are reliant on that philanthropy to continue the program because music therapy is not yet considered a standard of care in other rehabs. As a result, we are pioneering this as one of the first programs in the country and the first program in an inpatient rehabilitation center in New York State. Since its beginning, we have been able to expand our services from inpatient to also include outpatient services, now using the innovative telehealth to provide virtual services and reach people in the community. Our goal is to increase access to neuromusic therapy and reach as many people as possible because we believe this is the future of rehab. We believe that neuromusic therapy, in conjunction with occupational physical speech and recreational therapy, really is critical to maximizing a person's recovery.
You can expect to receive the highest quality of innovative care when you come to Burke Rehabilitation.
We are committed to providing patients with the best care available. The neuromusic therapy program specifically was funded by a grant as well as private donors, and we are relying upon that generosity to continue the program. One thing about Burke is that we are committed to working together as an interdisciplinary team to address the entire person. Through the various therapies, as well as nursing and social work, we are trying to address all of the needs a person has. Neurologic music therapy augments these services because they address impairments such as speech, language, memory, mobility, alongside the other therapists, to work together to allow a person to achieve their maximum function, their maximum independence. We also try to use the music of interest to them and be person-centered in all that we do. One of the reasons I love working at Burke is because I believe Burke is truly committed to providing the best care possible. And we have an openness to new ideas, new services. We want to be leaders in rehab. So administration's willing to take chances on programs such as neuromusic therapy or other technologies because we believe this is important and is the future of rehab.
To learn more about Burke Rehabilitation, visit the website at burke.org or see the segment again on thebalancingact.com.
Thanks so much for joining us on this local edition of The Balancing Act. We'll see you next time.